The following debates how Germany's healthcare policies are much more benefited towards its citizens than the United States healthcare policies are. This debate presents two positions on diverse healthcare systems in the United States and Germany. Health insurance in both Germany and the United States is employment-based. In 1883, Germany became the first nation to enact compulsory health insurance legislation. Employers and employees each pay half of 14.6% into a sickness fund that is distributed on a risk-adjusted amount per insured person. 86% of Germans receive their insurance this way. 11% are covered by voluntary insurance plans, and 3% are covered with special programs. Public health insurance is open to everyone, regardless if they are employed, self-employed, or unemployed. The sickness funds cover hospital and physician services, prescription drugs, and dental, preventative, and maternity care. The health insurance through the sickness fund will not end due to job change or unemployment. Germany's healthcare is merged between social insurance and public assistance structure. Only in 2010 has the U.S. had a government-supported program through the Affordable Care Act. The Affordable Care Act of 2010 revamped health insurance. Created were health insurance marketplaces covering 17 million Americans. These plans are often small, exclusive, and restricted, and provider choice. There are four base models of healthcare financing, including out-of-pocket, individual private insurance, employment-based private insurance, and government financing. Despite efforts, millions of Americans remain under or uninsured for healthcare. In the U.S., most hospitals and clinics are privately owned, with 1/5 being for-profit. Coverage by federal and state programs is partial, and most Americans have employment-based private insurance. Healthcare spending in the U.S. is $10,207 per capita, and in Germany, $5,848 per capita. And despite being less, Germany still manages to cover 100% of its population. In Germany, primary care and hospital doctors are two separate entities. Primary care providers join regional associations. Citizens choose their own primary care provider and do not need referrals to see specialists. Primary physicians are paid a global sum yearly from the sickness fund. Hospital physicians are paid similar to the United States diagnosis-related groups. PCPs are paid based on the number of patients cared for in each regional association. In the United States, people choose providers in their insurance network or risk paying out-of-pocket for services. Many primary care physicians have hospital privileges, but in the last decade, this has changed with hospitalists serving in the role of hospital provider. In Germany, physician fees are governed by the 1977 German Cost Containment Act, made of representatives of health providers, sickness funds, employers, unions, and different levels of government. The amount of money flowing to physicians has been capped since 1986. The gross domestic product fell from 8.7% to 8.3% from 1985 to 1990. In 1991, an upward surge in healthcare costs resumed, rising to 11.3% in 2017. The United States, however, spends the most out of high-income nations, at 17.7% of its gross domestic product on healthcare. Unlike the federal government and the United States, are commissioned to provide healthcare cost control and budgeting. The biggest difference in cost control is shown in the fact Germany's citizens do not cover out-of-pocket costs as Americans do. With supported policies, states plan to contain costs related to healthcare. In the U.S., healthcare spending is determined by prices and utilization, and there is provider-insurer competition. To conclude, Germany's healthcare system focuses more on care for all in the nation, opposed to the United States, where many citizens remain under or uninsured. By review of both healthcare systems, it has shown Germany's system is far better than the United States system.